you ever heard anyone say, hormone replacement therapy causes breast cancer? Never take hormone replacement therapy. Or your doctor might be a little nervous about giving you hormone replacement therapy if you have any family history of breast cancer, which, by the way, 1 in 8 women get breast cancer regardless of family history. I'm Cindy. I'm a cancer genetic counselor, and I talk risks for cancer with my patients all the time and what we should be doing about them. But the question here is, what are the top 5 risk factors that increase the risk for breast cancer? Hormone replacement therapy isn't at the top of the list. It definitely hit the media when the Women's Health Initiative published their data on hormone replacement therapy and breast cancer, but it's not as big as you think. What are the top 5 factors that change the risk the most for women to get breast cancer? So these are in no particular order, but the highest impact factors. 1, genetic mutations. Only 5 to 10% of breast cancer is hereditary. And there are some genes that give higher risk for breast cancer than others. But the genes that I think most people may have heard about in the media, BRCA1, BRCA2, or if you hear BRCA1 and 2, the same thing. They weren't very inventive on the name, by the way. It's breast cancer gene number 1 and number 2. So those 2 genes do change a woman's risk for breast cancer. If you think average woman has about a 12.5% lifetime chance for breast cancer. Women who have problems in BRCA1 or 2 have about 60 to 80% lifetime chance for breast cancer. Not 100%, by the way. So for those of you who carry problems in the gene, it doesn't mean you will get breast cancer, but that's definitely a big bump in risk. And women who have problems in BRCA1 or BRCA2 should definitely approach screening differently, may want to do some prophylactic options or ways to reduce their risks for cancer. And there's a few options there as well. BRCA1 and 2 are genes that give some of the higher impact on breast cancer risk. There are other genes that are not as high of impact risk. CHEK2 is probably the next most common gene for women to have problems in that can change the risk for breast cancer, but it tends to give women around 20 to 40% lifetime risk. It's actually in their favor not to get breast cancer if you think about that, but still big impact. Number 2 risk factor is what they call mantle radiation, which is a radiation to the chest wall if done prior to 30 years old. Now, this is a radiation therapy that they would use mainly for pediatric cancers. So say a child has Hodgkin's lymphoma and impacted in that area, then they may need radiation to take care of the lymphoma. The problem is this is irradiating tissue that is developing. The breast tissue develops during puberty, continues a little bit into the 20s. That is a very sensitive time for the breast tissue. Anybody who's had a pediatric cancer that was treated with radiation therapy to the chest, they probably needed it to survive that cancer, so it was important for them. But they should do extra breast screening because especially the radiation therapy that was used a long time ago for Hodgkin's lymphoma can change the risk for breast cancer almost as much as the BRCA gene. So definitely women who know that they've had that experience should be screened early and do extra breast screening. Risk factor number 3 is a biopsy that was benign, but called atypical hyperplasia. Any atypical hyperplasia, atypical ductal hyperplasia, atypical lobular hyperplasia does increase the risk for breast cancer. And the reason here is when they did that biopsy and pulled those cells out, those cells look like they're growing a little faster. That's what the hyperplasia means. They look atypical, so they look a little different. Now, they're not calling it a carcinoma, so it's not a cancer, but how you get to a cancer is by going through these other stages. Not everyone with atypical hyperplasia will develop breast cancer, but it definitely does change the risk. And if you've had a breast biopsy that showed that, you may want to do extra breast screening. You may want to take actions to reduce risk. There's some medications that can reduce risk. There's a lot of different options there, at least that extra breast screening. So what's number 4 on this list? It is age. The older you get, higher chance that you're going to have something build up that leads into a cancer. Much of that is just random. Some of it environmental. Some we have control over, some we have zero control over. The longer our cells are alive, the longer they have to build up problems within our cells that might turn them cancerous. Breast cancer tends to happen after menopause. That's really probably just an age factor. So the longer we live, have a higher chance to get cancer in general, but breast cancer is impacted by this as well. Number 5 risk factor is weight. Now, weight is not the easiest thing to control. And the hard thing about this risk factor is it seems to have a bigger impact after menopause. If your BMI is higher than 30, and no, BMI is not a great measurement, but it's what we have. If your BMI is over 30 and you're postmenopausal, that definitely increases the risk for breast cancer. The hard thing about that is menopause itself makes it harder to keep a healthy weight. Those drop in hormones make it harder to keep your weight healthy. So women after menopause do tend to increase in weight faster than they tend to before menopause. So it's not the easiest thing to control, but that does mean try to keep it as much in control as possible. You see what works for you, try to keep a healthy weight. Okay, so those were the 5 big ones, but if you want to know some bonus, more minor impact risk factors for breast cancer, we'll go through a few here. And if you want to know a few risk factors that can lower the risk, we'll also touch on those. There's definitely some things that we have no control over. When we get our first period, when we go through menopause. Many, not all, but many breast cancers have receptors for estrogen and progesterone and are impacted by our lifetime exposures to those hormones. If a woman gets their first period prior to age 10 or earlier, I'd say 12 is average, but if they get the first period early or go through menopause late, average age for natural menopause is about 51. Now, early 50s is just normal, but if they go through menopause later than average, then their ovaries are making estrogen and progesterone for a longer window of time. That can increase the risk a little bit for breast cancer. Family history can increase the risk for breast cancer even if there's no gene involved. I talked about this in another video, I'll link here. Family history, especially in the closer family members, but in general, family history of breast cancer can change a person's risk for breast cancer. So it may be worth going to a genetic counselor or going to a high-risk breast center just to gauge where your risk is if you have a family history of breast cancer, because that can impact screening recommendation. Another thing that can increase the risk for breast cancer is having your first child at a later age or not having children. I will say this is not the reason why people decide to have kids or to have their first child young, but we do know that women who have their first child later or who do not have children at all do have a slight increase in breast cancer risk. Now, other lifestyle factors can also play slight roles in breast cancer risks. So things like drinking alcohol can increase the risk for breast cancer. Now, there's not a recommendation to not drink alcohol, but they definitely say limit it. The less the better in general. Smoking, there's hit or miss on the studies on whether it plays a role in breast cancer risk. It may. Secondhand smoke exposure may also impact the risk slightly, not as much as it impacts the risk for other cancer types. Keeping a healthy lifestyle, eating healthy, not smoking, limiting alcohol can all help keep cancer risk lower in general, including breast cancer risk. So that does bring me to what can you do to actually help keep your risk a little bit lower. Now, I should mention nobody has a zero risk for breast cancer, even men, but what can we do to help keep these risks on the lower end of the spectrum? The main things to do here would be things like eating healthy. Now, it's hard. Everybody has a different idea of what healthy is, but not eating so much junk food, eating food that is closer to its source and not as processed is probably a good idea and a good starting point. Exercising 5 days a week. Exercising 30 minutes a day, 5 days a week has been shown to slightly decrease the risk to get breast cancer, as well as some other cancer types. It can also help with weight, but even independent of your weight, that exercise can help decrease breast cancer risks. Breastfeeding also helps reduce the breast cancer risk. Again, this is one of those factors where it's not always the reason why a woman decides to breastfeed or not breastfeed. There's so many other factors that go into that. But if you are able to or were able to breastfeed, that does help keep the risk a little bit lower as well. One other thing that does decrease the risk for breast cancer that we don't have any control over, but if you fall into the scenario, might help reassure you a little bit. Either getting your first period later than average, 15, 16 rather than 12, or going through menopause earlier than average. So say if you have your last period in your early 40s, maybe 45 or younger, that lowers the exposure to estrogen and progesterone over time and decreases the breast cancer risk overall. Okay, so the big question is, how do you know what your specific risk is, or at least an estimation on that based on all these factors? And the best way to do that is to run some risk models that can take into account things like family history, when you got your first period, go through menopause, kids, put that information together to give a estimated lifetime risk for breast cancer. In models that take into account multiple generations in the family history along with some of these personal risk factors, if one of those models gives you 20% risk or higher, then we do recommend that you do breast MRIs in addition to your mammograms every year. And we may recommend starting a little bit earlier than 40, which is the more typical age to start screening. How do you get access to have these models run? If you have a local high-risk breast clinic, that could be one way to do that. Or if you want to, you can speak to a genetic counselor. There is a webpage I'll link in the description below called findageneticcounselor.com, where you can search for a genetic counselor in your area, or they do list those that have telehealth services as well, so either phone or video option. That is where I would start to see if you should be doing extra screening based on your personal risk factors. I will post a video on those models at the end here, so if you're interested, you can click on that. And if you find this information helpful, please subscribe and hit the bell button so that you're notified for future videos as they come out.